Staff working at the Cobequid Community Health Centre say Tuesday was like Armageddon. The ambulatory care facilities team was overrun with a lack of manpower and physical capacity to take in more patients.
People felt so overwhelmed that they called their MLA's office, so it tells you how bad things were.
In a letter to the health minister, Wozni described the scene. As of noon, 18 of the 26 emergency beds were filled by patients requiring inpatient care and were awaiting transfer to hospital. He adds several of these patients had been waiting for inpatient transfer in excess of 70 hours. Meanwhile, some waiting for care had to be turned away by the emergency team, including an individual who had suffered a stroke.
And really the standard is 24 hours. And to be waiting more than 70 hours before you even begin to access that follow-up care, it's really scary.
The Nova Scotia General Employees Union represents 300 healthcare personnel at the Cobequid site. And according to their president, Cobequid is not set up to board patients beyond the 24-hour threshold, which Mullen says has a severe mental impact on their members.
They want to provide service, but they need to do that with adequate staffing. And so that is a serious concern when they recognize positions that are not filled and the fact that they need that support.
In a statement, the health minister says Nova Scotia Health is undergoing a review of its existing buildings and services in the central zone. The review will identify where various services should go and opportunities for improvements and modernization, including at the Cobequid Community Health Centre. But Wozni says Tuesday's perfect storm highlights critical problems with how the healthcare system functions within HRM.
I worry about all of our eggs being in that basket, to fixing the healthcare issues in Metro. It makes sense to invest in emergency care outside of the downtown core so that people have timely access to the care that they need.
MacDonald, Global News, Halifax.